Good afternoon, everyone. We at Softsquare are delighted to welcome you all to our webinar today. Now, our CEO, Mr. Andy Giri, is going to give a brief introduction about the company. Off to you, Mr. Andy.
My name is Andy Giri. I am the managing principal at Softsquare. I am absolutely delighted to invite every one of you to today's webinar on our Work.com series. Softsquare has been delivering over 500 Salesforce implementations over the last 12 years. Our practice covers the length, breadth, and depth of the Salesforce ecosystem. When I say length and breadth, I mean that we have practice groups across all of the Salesforce ecosystem tools, such as B2B Commerce, Sales and Service Cloud, the Salesforce Platform, CPQ, Communities, both customer and partner, Heroku, MuleSoft, and of course, AI apps using Einstein. At Dreamforce 2019, Softsquare was featured as a top-tier product development organization, otherwise called PDO. We have achieved this credential through our team's capabilities to build 33 apps for the Salesforce App Exchange. In the last 3 months, we at Softsquare have expanded our practice towards several initiatives that would help our customers efficiently handle this global pandemic. Back in June, just a few weeks after Salesforce's timely introduction of reopening toolset Work.com, we launched our Work.com practice. We did several webinars educating our customers and prospects on how Work.com's wellness surveys, shift scheduling, and health cloud can help companies reopen in a safe way, triage infected personnel to professional healthcare, and also effectively leverage their healthy workforce. In order to fully contain this pandemic, it has become very important to have a vaccine formulated, manufactured, and properly distributed among the world's population. Drug makers like Pfizer, Moderna, and Johnson & Johnson are all rushing to develop a remedy in record time. Just about 10 days back, Salesforce launched the Work.com for Vaccines program. As you can see on the screen, CEO Mark Benioff appeared on Jim Cramer's Mad Money session last week, citing Work.com's public sector customers like the city of Chicago and state of Texas who are deploying this vaccination software on top of Work.com. As part of Salesforce's Customer 360 platform, Salesforce has designed Work.com for Vaccines applications to be capable of coordinating the distribution of COVID-19 vaccines to inoculate billions of people across the globe. In an emergency situation like this, the public sector is going to experience a dramatic increase in inquiries, questions, response coordination, and reporting. In today's session, Dr. Alexander Peter, our data scientist and COVID-19 technology specialist, is going to present the all-important topic of emergency response management. Welcome, Dr. Peter.
Thank you, Mr. Andy. Welcome and good afternoon, everyone. SalesforceWork.com provides 3 essential solutions: employee health screening, shift management, and contact tracing. They are designed to help businesses reopen the workplace as quickly as possible while helping to keep employees, customers, partners, and communities safe and informed during the COVID-19 crisis and beyond. We at Softsquare have integrated Einstein AI for automated mask detection, capacity management, monitoring crowd social distancing, and automated mobile device contact tracking for tracing using Bluetooth beacon technology. In a passive-aggressive emergency situation like this pandemic, a self-service portal is critical. Citizens can safely use the portal using their computer, tablet, browser, or mobile device. This will significantly reduce caseloads and phone support calls. Within the portal, citizens can see important announcements, news, blog posts, videos, knowledge articles, and information to keep the citizens safe and healthy. In this portal, The citizens can take a COVID 19 health assessment, find a healthcare provider, and locate regional emergency service agencies. There is an AI assisted chatbot embedded in the portal. As you can see on the bottom right, that can help citizens find information quickly by interacting with the bot. This is a fundamental shift in the digital transformation from traditional forms to the digital modernization of using intelligent chatbots that can take feedback from the user and recommend solutions. The bot can be configured to provide key information, case status, alerts, and even transfer to a live service agent. The bot can also interact on mobile device messaging systems. Now, our Director of Marketing, Sridhar, is going to present the ERM high-level journey.
Thank you, Alex. Hope you all are doing good today. The diagram portrayed in this slide gives us an overview of how the ERM system works. The ERM system majorly entails contact tracing, request management, and volunteer management. I request everyone to check our previous sessions on contact tracing, which will be shared post this webinar. The initial step is for the user to log into the citizen portal set up by the respective public sector agency. Then the user interacts with the chatbot to enter their detail, post which they will be able to schedule an appointment with their local doctor. And finally, a clinical assessment is conducted to check whether the citizen is COVID positive or not. Post clinical assessment, specific services can be availed by the citizen. For getting a service, the citizen has to raise a service request which will be approved. Once this service request is approved, an assigned volunteer will render the requested service. This is the request management section. Volunteer management is displayed as a separate flow in the same diagram. If any individual is interested in becoming a public sector volunteer, they can sign up using the citizen portal. Once they are inducted as volunteers, they will be handed out a service schedule with all the details which they can go ahead and then execute. Now back to you, Alex.
Thank you, Sridhar, for the high-level overview. Now here are the 5 phases of the service blueprint for ERM Public Health. Under COVID support phase, we have a public site with interactive chatbot. In the lead appointment phase, citizens can register and schedule for an appointment. In the clinical assessment phase, the health coordinator can follow up on leads to collect health and contact encounter details to enroll in the care program. In the service request phase, there is a login portal where the citizens can raise requests such as food, PPEs, and other emergency relief. And finally, the visit phase is a volunteer management system to perform volunteer activities such as schedule visit plans using Salesforce One mobile app and execute delivery using Salesforce Map. Now our sales engineer Kanmani is going to give you a tour of the ERM package.
Thank you, Alex. Now let's take a look at the schedule and appointment screen. During emergencies, citizens often need service. By utilizing Salesforce automation tools, citizens can complete assessment to determine the eligibility, and after approval, they can schedule an appointment to receive a test or pick up supplies. Once I filled out the information, it creates an appointment. Now let me switch to a lead page. It is a triage lead that got created. Let me choose John record. Now let me change my persona as a triage coordinator where the lead is assigned to me. And as you see, I have all the details filled here. And now I'm going to talk to John as a call setup. Now we start a new clinical assessment. When I'm talking to John, I have some of the information and I have asked some question to him based on his information that he provided. The clinical assessment evaluation result will be created. As soon as we finish the clinical assessment, You will see John would have converted to person account, and also it would create a task to follow up with John in terms of contact tracing, which means it would have contacted health coordinator with a task, and they have contacted John and asked him about who all the people outside or his household he had been touched with. So let's take an example of what we already created. As you can see here, he has been enrolled in the life event program. Here you can see a couple of information about him. Also, let us look at contact tracing graphs. Once he said that he had talked to the people outside his household, we got these many people were contacted by John. Next is the household part where John had talked to the people inside his household. So now let's switch to a request management module. Now we are looking at the request management. Here the patient or citizen comes to our website and requests some resources. In this case, the citizen is requesting resources for individual and families. Once they submit their request, once the request get approved by the internal team, next is going to a scheduling model. This is where you can do a manual scheduling or you can use a Salesforce map. Here we are using Salesforce Map. Now looking at all emergency requests, and I'm going to assume here in a San Francisco, there are several things that we need to schedule and we can go here. Now I'm going to draw a polygon, look at all the places, and now I'm going to click Add Schedule button. After schedule, the schedule might have different volunteers to go make this delivery. Once the schedule is created by the scheduler, the volunteers can see their schedule in the mobile app. Here is a screenshot of the mobile app in action. The volunteers receive instruction on the delivery. Once the volunteers deliver the request, the status in the emergency request application is set to completed. So here is the end-to-end workflow of mobile app emergency response management for the public health. Now this concludes the live demo. Back to Purnima. Thank you.
Thank you, Kanmani. Alright, so this concludes our webinar for today. Please ask any questions in the chat and also we'll follow up through email. We look forward to seeing you all in our next webinar. Until then, stay safe, take care, and have a good day.